The last 19 months have been anything but easy for doctors and nurses inside this Montreal ICU.
We've had a lot of deaths, and we've had a lot of young patients die. And it's frankly hard to see these people die.
Add to this staffing and bed shortages.
We scramble and we do our best to try and accommodate every patient.
For almost 2 years, the pandemic has highlighted the ever-growing cracks in Canadian healthcare. In Toronto, these nurses say they are underpaid and overworked.
We cannot carry triple, quadruple workloads and keep you safe.
In Alberta, the ICUs are overflowing. Exhausted physicians have been begging the province for help.
Yes, beds have been opened up, perhaps a monitor's been attached to them, but there are not the staff available to care for those patients.
The federal government has a plan in place to send assistance, but members of the Canadian Medical Association and the Canadian Nurses Association worry Ottawa is ignoring the bigger picture, asking for funding for staff and a federal system to track the shortages.
We have been telling them for years these are issues. We've been working in an environment of austerity, understaffing, inadequate resources. But what we see is instead of politicians actually owning this, governments owning this problem, they bounce the issue back and forth.
Ministry Health says there is more to do, but human resources ultimately is a provincial responsibility. In Quebec, as it begins to enforce its healthcare worker vaccine mandate next week, more staff could be lost.
It's like a wild roller coaster, to be honest. A lot of workers have left.
It's turning to local paramedics to fill the gap, a short-term solution to an unprecedented situation. Mauracher, Global News, Toronto.